My name is Dr. Shannick Wick, and I am a psychiatrist and medical director of Neaurlia TMS. Neaurlia has been a WA pioneer of TMS, which is a drug-free, non-invasive, and often long-lasting treatment for a number of mental health and pain conditions. So what is TMS? Transcranial magnetic stimulation is a next-generation treatment that uses an MRI-level magnetic field to activate underactive regions of the brain. When this is done repeatedly, neuroplasticity can be promoted. In other words, increased connectivity between the nerves. The result of this treatment is often maintained over time. Transcranial magnetic stimulation was first developed for treating depression, but over the years it has been shown to work for the treatment of anxiety, PTSD, OCD, chronic pain, fibromyalgia, and migraines. Because it is non-invasive, drug-free, and well tolerated, people having this treatment can return to their normal activities like driving or work immediately after finishing their appointment. This treatment has been used around the world for over 30 years. It was first developed in the UK in 1985. In 2008, the FDA approved it for depression. It has been in Australia for around about 15 years, but mostly in private mental health hospitals. The big change now is that TMS has been listed on Medicare for patients with depression. So how does it actually work? Well, the nerves of our body operate via tiny electrical signals. When this is exposed to an external medium, somewhat dormant nerves can be activated. When done repeatedly, we forge greater neural connections. While this principle is fine for activating the nerves in the hand, it is a lot harder to access nerves in the brain as it's protected by the skull, a very poor conductor. But there is a way around it, as discovered by Professor Barker in 1985. Magnetic fields can easily pass through the skull, like we observe with an MRI. And as Michael Faraday predicted, a varying magnetic field can cause induction, and in this case, nerves firing. The varying magnetic field is produced and controlled by the coils of our TMS machines, which are able to pass through the skull unimpeded and activate underactive regions of the brain. Where we place the coil depends on what area of the brain we are trying to target. Different conditions require different targets. Let's use the treatment of depression as an example. In depression, functional MRI and PET scans have shown that the left prefrontal cortex, around about here on my forehead, generally has decreased activity. When we treat depression, the coil is placed over this exact region. The location of an individual's prefrontal cortex and the amount of energy required to activate the nerves is determined during the mapping appointment. These parameters are unique for every patient. Determine the amount of energy required by targeting the motor cortex, which we can measure by causing an involuntary contraction of the hand. The identical amount of energy will be required to activate the nerves in the prefrontal cortex. During the treatment, the coil will rapidly direct a number of magnetic pulses into the target area. The magnetic field causes the nerves to fire, and over time, this promotes neuroplastic and dendritic growth. During treatment, the coil will rapidly direct a magnetic pulse into the target area. The magnetic field causes the nerves to fire. Over time, this promotes neuroplastic and dendritic growth, and in a way, allows this region of the brain to wake up. If you have any questions or would like to learn more about TMS, ketamine, psychedelics, and other next-generation psychiatric treatments, please do not hesitate to call our friendly Neaurlia team or visit our website, where we have a number of articles and explainer videos. I look forward to meeting you at one of our regional WA or Perth clinics. Thank you for your time.